welcome to the Chelmsford Medical Centre reception. Now I'm here today to talk to the cosmetic surgery team about any questions and perhaps concerns that you may have about breast augmentation and uplifts. We're going to be looking at the difference between the two procedures and finding out exactly what they entail. We'll answer previous questions asked by patients, look at some of the risks that are involved and see some client testimonials. Well, I've signed in, I've had my coffee, and now I'm off to meet Professor Frame, who's one of the cosmetic surgery team here at the Chelmsford Medical Centre. Professor Frame is Professor of Aesthetic Plastic Surgery at Anglia Ruskin University and is an executive committee member of the British Association of Aesthetic Plastic Surgery. He has over 25 years' experience specialising in aesthetic and reconstructive surgery. Hello, Professor Frame. Now, many of those watching will know the difference between a breast augmentation and a breast uplift, but just in case, can you tell me a bit about the difference?
A breast augmentation is where we enlarge the breasts, either by means of fat grafting, injectables, but most commonly with implants, breast implants. And a mastopexy or uplift is all about lifting the breasts and relocating the nipples, usually into a higher position, shuffling everything around and taking it away from a low droopy position into a more youthful positioning on the chest wall.
So how does the procedure actually affect the shape of the breast? I've heard a lot about teardrop or round. What does that actually mean?
I think the word teardrop was coined by a man in America, and it's put into the design of a certain type of implant where it's narrow at the top and broader at the bottom. And it's an implant which gained favour in the early 1990s, at a time when the silicone was causing a big scare throughout the world. That implant, as a shaped implant, has its uses, the teardrop shape, but it is prone to causing problems, not necessarily immediately, but later on. The teardrop shaped implants are actually prone to rotating, and if they sort of rotate through an angle, then it doesn't remain as a teardrop shape anymore, and if one rotates and the other one doesn't, you end up with a misshape and an embarrassment. In your clothes, they look completely wrong. Out of your clothes, they look a disaster. So there are times when the teardrop shape will work, and that is when you have a broad chest wall and a short height breast, because those oval shaped implants actually do look quite good when they use the teardrop prosthesis.
So I've decided to opt for a breast lift. What exactly does the procedure entail?
It depends again how we're going to do it. A breast uplift means you have to come into hospital and you often have to undergo quite big surgery. It's not usually painful surgery, I have to say, but there's a lot of moving around, and it takes about 3.5 hours probably to do a proper mastopexy. And I say proper because there are different ways of doing it. From a simple little operation where you just lift the nipple through an incision around the nipple itself and then make a bigger incision and just shuffle one into the other, that doesn't usually give a good long-term result. It usually means the breast will bottom out and fall down. So we then have to think in terms of a scar that goes around the nipple and then vertically down. That's called a lollipop scar. But for those with very loose skin, you actually have to make a scar that goes around the nipple vertically down and then horizontally underneath the breast, and that's what we call an anchor scar.
So the end results mean they'll be more even?
Yeah, with a mastopexy, you have the opportunity to equalise the breasts, either by augmenting the smaller breast with a little implant, or by reducing the bigger breast, and then doing the standard mastopexy, having done a little mini reduction. There is a new technique which we've had access to since last October called a brief-form mastopexy, known as an internal bra, and it's like a membrane that goes inside the breast and it holds the boob into a position on the chest wall by stitches. You don't actually see this device, but it actually sits in your body and it holds your breast there for the rest of your life. So 7 out of 10 girls, if you choose the right lady, won't actually need to wear a bra again for uplifting again. So it is actually quite a novel and very, very ingenious bit of equipment.
Can I expect a change in the nipple sensation? Will they be more or less sensitive?
Addressing sensitivity, they may be more sensitive for at least 3 to 6 months, what we call hypersensitivity, not unusual. And some girls have to wear little silicone gel pads inside their bra to stop them rubbing. That type of sensitivity is common for women get what we call jogger's nipple. super sensitive nipples. A fairly large percentage, probably around about 70 to 80%, don't have any change in the sensitivity, and the rest may lose it completely. So up to about a third of girls can lose it. Now for larger breasted girls with sagging boobs, generally speaking, I don't think anybody has ever said that's a sacrifice not worth making. For the very small breasted girls, it's slightly different. They seem to have this perception that you've got to have sensitive nipples, and it is part of the equation about the benefits and risks of proceeding with this type of operation.
I've not had children yet, but I'd love to in the future. Will I still be able to breastfeed?
With a mastopexy, it depends really how much operating, how much dissecting we do. If we're going right into the breast tissue and shuffling it all around, it's probably better to say you won't breastfeed. You will produce milk, but probably not enough to keep the baby going. If you do the breeform, we're not interfering at all with the breast ducts or the glands, and therefore you can breastfeed. With regards breastfeeding after breast augmentation with implants, you can breastfeed absolutely normally because we don't actually see any of your breast tissue. Implants are placed in a plane deep to the breast, which is either in that immediate plane from breast to muscle or actually behind the muscle, but at no stage do we see any breast tissue. Therefore your breast will engorge with milk if it can do that after you've had your baby.
With a procedure like this, will I expect to find some scarring, and if so, will it be visible?
The scars from augmentation and mastopexy are actually completely different. The augmentation, the scars generally speaking are best placed underneath the breast so that as the boob falls down you don't actually see the scar. It could also be a scar around or through the nipple to put an implant in. That's fine as long as you've got big nipples. For a girl with very small nipples, which generally speaking is what goes on, we'll talk about the areola, which is the coloured bit around the projecting part of the nipple. If you have a small areola, it's actually impossible to put these newer implants through a small hole without creating a lot of trauma, therefore we don't do it. You can have it put in through the armpit, particularly if the implant is going to go behind the muscle on the chest wall, but for today's girl that wears off-the-shoulder type clothing, if you're forming a bad scar and you start moving around, people will see that, and therefore it's not such a good idea. And in my experience, most people having that approach end up with an implant that's way too high on the chest wall, so they don't look good out of a bra. With a mastopexy, it's slightly different in that the scars are more extensive. They always go around the nipple, and it's a question of whether they go downwards and horizontally underneath the breast as well. And it depends what we're trying to achieve with the mastopexy as to which scar we would give you. Those scars are fine as long as we choose the right person. Now, most mastopexies are in women that have had children, where the skin is a little bit looser and it tends to fall down. When we're doing an uplift on that sort of lady, the scars generally do very well. Scars don't do well on girls that haven't had children, hasn't been stretched before. They're auburn, ginger-haired, Celtic origin, Mediterranean, black-skinned people. They don't do well with scars. They can form what we call keloids. And then the price to pay of a bad scar doesn't outweigh the benefit you're actually going to get.